Hi there, my name's Hugh Cullen and I'm the National Secretary of the Scottish Socialist Party. Ever since the start of this pandemic and lockdown, the Scottish Socialist Party has been campaigning for a national care service, that's free at the point of need and publicly owned and run, including a recent opinion poll which found that nearly 70% of Scots support the Scottish Socialist Party's plan for a national care service. We've collected tens of thousands of signatures for the First Minister, Nicola Sturgeon. That national care service will cover all forms of social care and care which is currently not covered by social care, to reward the hard-working carers and unpaid carers in the sector. But one of the main reasons that we're now reiterating our support for a national care service is because of the shocking number of coronavirus deaths in privately owned residential care homes during 2020 and heading into the year 2021. As part of that campaign, we've been leafleting, trying to raise the profile of the demand in workplaces and communities. We've been reaching out to experts from universities, public health experts, trade unionists, and we've been trying to collect the testimony of lots of care home and social care workers. Now, understandably, lots of those care workers are willing to speak to us and give us written testimony, but lots of them have raised concerns about retribution from their workplaces if they're found to be speaking out about some of the practices and conditions that are going on in care homes at the moment. So we're very grateful to one of our activists who has recorded and transcribed the interview which you're about to hear just now. We've to protect the name of the care home worker, who is an experienced care home worker with over 20 years experience in the sector. We've asked an actor to record her voice, and we've also renamed her as Tracey. So without any further ado, we're now going to hear from Tracey, and we're going to hear what her responses were to the questions that she was asked by a Scottish Socialist Party activist. So thanks very much, Tracey, for joining us. The first question is, what's the mood of staff in your care home at the moment?
Oh, pretty down, to be honest, because of COVID, I suppose. That's stopped us being able to do a lot of stuff, and obviously the residents are not happy either, so it doesn't really make a good place to be for 12 hours a day. Don't get me wrong, I don't think things were great before coronavirus either. The management are much more inclined to do what makes them feel happy than anyone else. Residents aren't allowed to touch anything or do anything at the moment. It's just outrageous. The residents don't know the management either. They don't know who they are, even though they're here every single day, because they're not interested in what's happening on the floor.
And how are you treated by your managers?
Not like a great carer, as we all are. Nobody ever tells you you've done a good job or anything. We're just told to keep doing the same the next day. And it's not like we want praised every minute. You just want to know you're appreciated, like great job or well done every now and then goes a long way. In the home, there's not enough staff to start with anyway. You just have to get on with your job and that's it. For example, we've got 4 floors. So there's meant to be 3 carers on each one, but sometimes there's only 2. Then there's me, I work in the foyer. Then there's a couple of domestic staff that are full-time, 4 maybe. And you've got 2 nurses on both shifts. That's about it. We need at least another half a dozen, like bare minimum, just so people can take their time with things and be more careful, create a nice environment, be able to take the residents for a walk so they can get some fresh air, stuff like that. Be able to take them out and let them smell the sea, not just see it out the window. But we can't do that much at the moment at all because we just don't have the time. On a 12-hour shift, if you're on a 12-hour shift, they don't pay us for any breaks. I get 2 half-hour breaks that I pay for. I get paid 33 hours and I work 36. So 1 hour a day, I get a break I'm not paid for.
Mm-hmm. Do you know what the current cost of care for your residents is? And if so, do you think it's fair?
Oh yeah, every month it's about a couple of £1,000 each, and that's per resident. And I don't think that represents what they get back, to be honest, because we're not allowed to do stuff we want to do with them, like sit with them and play a game or anything. There's just no time for anything but basic care, if I'm honest. There was an in-house survey done recently, actually, from head office for the residents, and they weren't happy at all. And that's just coming from the ones that could understand what they were being asked. It was one of those ones that you had to do it on a 1 to 10 scale, and where it was like 1 where you're least happy and 10, you know, most happy. And mostly it came out as ones. Every home in the group that we're in had the same one, and I'd imagine ours came off as the worst, even though we all work so hard. It's just so demoralising.
What's the current process if you or your colleagues wish to lodge a complaint or suggest some changes within your workplace?
Yeah, that doesn't go down very well. We have a resident who's quite violent. He just goes about swearing and hitting the carers. And we said to the boss that we thought he was quite dangerous. And then one night she was going to leave me with him on my own with 15 other residents to care for. And I sort of suggested that it wasn't a good idea. What was I going to do if he got aggressive? And she said, well, everybody else has to do it, so you'll just have to. That was her answer. I got the violent man in the room with everybody in the end, so it worked out okay. But I think if I'd pushed that any further, my job would have absolutely been in jeopardy. They really don't like it when people go against them, and then they start putting words around the home that you're a bit of a troublemaker. Then you're kind of shut out or get the worst jobs, and people can't take that for very long. I certainly couldn't.
Do you feel that your management team values the work that you do?
I think the other nurses do, and the people you work with every day do. They appreciate you. Management don't really. They don't even seem to know much about their employees, to be honest, or care.
And do you feel like the public value the work that you do?
Oh yeah, I really do. The families and the visitors that come in, they might just be like dropping something off or whatever, or asking extra questions about their dad or their mum or how their nana is. And they know that you're doing more for them than you have to. But most people say that they couldn't do the job that I do, that they wouldn't want to, but they know that somebody has to. So I do, you do feel appreciated by the general public.
And the final question is, what do you think of the SSP's demand for a free at the point of need, publicly owned and run national care service?
I think that whoever runs a home has to come and see personally how it's run and how the residents are doing and what they need. In my opinion, the people that own these places should look beyond the paperwork. They're not bothered about the daily routine or the actual care as long as money's being made. If they were bothered, they'd come and ask the staff what's happening. They would ask the people that are on the floor doing the job every day. Otherwise, how would you know how it works? It's a place for people. There should be more say from the people actually doing the work, not the managers and not the shareholders or whatever. I think a care system like you've described would be much more realistic for the care staff, the residents, instead of something that's private. It seems to be that there's nothing you can say or do to change anything when it's private. Everything's their decision. There's not many people that are happy working in a privately run care home because you don't have a lot of say in what goes on. They can just tell you whatever they want because nobody will stand up to them. They're in charge and you're just very replaceable.
Thanks to Tracey and the SSP activist who conducted that interview. You can visit scottishsocialistparty.org to find out more about the work we are doing to make working people's voices heard, demanding justice for their not fit for purpose, profit-driven care model in Scotland, including our contribution to the Scottish Government's review on social care that reports in January. On there, you can get in contact to share your experience of care in Scotland, donate to support the campaign, and join the SSP, Scotland's Socialist Party.